Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Noncompliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter. Which should the nurse observe for on the cardiac monitor as a result of this laboratory value? 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. A serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves. Which of the following is essential when caring for a client who is experiencing delirium? 1. Controlling behavioral symptoms with low-dose psychotropics. 2. Identifying the underlying cause of condition or illness. 3. Manipulating the environment to increase orientation. 4. Decreasing or discontinuing all previously prescribed medications. The correct answer is 2. The most critical aspect when caring for the client with delirium is to institute measures to correct the underlying cause of condition or illness. Controlling behavioral symptoms with low-dose psychotropics, manipulating the environment, and decreasing or discontinuing all medications may be dangerous to the client's health. While caring for a prima gravida client with Class 2 heart disease at 28 weeks gestation, the nurse would instruct the client to contact her primary health care provider immediately if the client experiences which of the following: 1. Mild ankle edema. 2. Emotional stress on the job. 3. Weight gain of 1 pound in 1 week. 4. Increased dyspnea at rest. The correct answer is 4. Increased dyspnea at rest must be reported immediately because it may be indicative of increasing congestive heart failure. Mild ankle edema in the 3rd trimester is a common finding. However, generalized or pitting edema, suggesting increasing congestive heart failure, must be reported immediately. Emotional stress on the job increases cardiac demand. However, it needs to be reported only if the client experiences symptoms, such as palpitations or irregular heart rate, indicating heart failure related to the increased stress. Weight gain of 1 pound per week is a normal finding during the 3rd trimester. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. Although home visits, family monitoring, and outpatient monitoring may help, if the adverse effects are not controlled, the client is less likely to take the drug, which would interfere with its effectiveness. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanursguide.com. Back to the questions. What is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks? 1. Calling the client's mother once a day. 2. Attending day therapy 3 times a week. 3. Allowing 2 friends a visit every day. 4. remaining out of bed for 10 hours a day. The correct answer is 2. Attending day therapy 3 times per week is a long-term goal that will show the most progress in overcoming withdrawal. The client's calling his mother is a first step in getting out of severe withdrawal. Allowing 2 friends to visit every day would be appropriate if the client is successful with calling his mother once a day. Insufficient information is presented in the scenario to indicate that excessive sleep is a problem. Which of the following statements about a fetal biophysical profile would be incorporated into the teaching plan for a prima gravida client with insulin-dependent diabetes? 1. It determines fetal lung maturity. 2. It is non-invasive using real-time ultrasound. 3. It will correlate with the newborn's APGAR score. 4. It requires the client to have an empty bladder. The correct answer is 2. The fetal biophysical profile, a non-invasive test using real-time ultrasound, assesses 5 parameters: fetal heart rate reactivity, fetal breathing movements, gross fetal body movements, fetal tone, and amniotic fluid volume. Fetal heart rate reactivity is determined by a non-stress test. The other 4 parameters are determined by ultrasound scanning. The results are available as soon as the test is completed and interpreted. The lecithin-sphingomyelin ratio is used to determine fetal lung maturity. Although the fetal biophysical profile is useful in predicting which fetuses may be at greater risk for compromise, there is no correlation with the newborn's APGAR score. The biophysical score is sometimes referred to as the fetal APGAR score. A score of 8 to 10 indicates fetal well-being. Use of an ultrasound requires the mother to have a full bladder. The cervix of a prima gravida client in active labor who received epidural anesthesia 4 hours ago is now completely dilated, and the client is ready to begin pushing. Before the client begins to push, the nurse should assess: 1. Fetal heart rate variability. 2. Cervical dilation again. 3. Status of membranes. 4. Bladder status. The correct answer is 4. The bladder status should be monitored throughout the labor process, but especially before the client begins pushing. A full bladder can impede the progress of labor and slow fetal descent because she has had an epidural anesthetic. It is most likely that the client is receiving intravenous fluids, contributing to a full bladder. The client also does not feel the urge to void because of the anesthetic. Although it is important to monitor membrane status and fetal heart rate variability throughout labor, this does not affect the client's ability to push. There is no need to recheck cervical dilation because increasing the frequency of examinations can increase the client's risk for infection. The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner, while adding that the medicine also will help, clearly and directly states the need for medication. Stating, God helps those who help themselves challenges the client. Stating, God wants you to take your medicine is deceitful. Stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious. The primary health care provider prescribes betamethasone for a 34-year-old multigravida client at 32 weeks gestation who is experiencing preterm labor. Previously, the client has experienced 1 infant death due to preterm birth at 28 weeks gestation. The nurse explains that this drug is given for which of the following reasons: 1. To enhance fetal lung maturity. 2. To counter the effects of tocolytic therapy. 3. To treat chorioamnionitis. 4. To decrease neonatal production of surfactant. The correct answer is 1. Betamethasone therapy is indicated when the fetal lungs are immature. The fetus must be between 28 and 34 weeks gestation, and birth must be delayed for 24 to 48 hours for the drug to achieve a therapeutic effect. Antibiotics would be used to treat chorioamnionitis. Betamethasone is not an antagonist for tocolytic therapy. It increases, not decreases, the production of neonatal surfactant. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.